Hey guys, it's Professor Hussein again. So in this video, I just kind of want to clear a couple things up about why the baby booming generation is so significant in the healthcare industry, especially right now. And it's something that we all need to kind of be mindful of and follow with what's going on with that. Because I'm pretty sure you guys have all heard, especially in politics or even just people talking about it or in your classes, because I know I mentioned a lot in my courses as well. But so you hear a lot of baby boomers, the baby boomers, they're retiring. What are we gonna do? So why is the baby booming generation playing such a huge role right now, especially in the healthcare industry? There are two huge reasons, okay? So first of all, the first one is that, and I think we all know this because I've said it so many times, the baby boomers are getting older, okay? They're all getting older. As we move forward, okay, in the next coming decade, they're all going to be going into retirement, leaving the workforce, things like that, and they're getting older, which means, of course, what happens when we get older and we age? We require more medical care. We start kind of withering down or whatever. Some of us need more care than others, but usually when we get old, we need more care. So it's expected that a lot of these baby boomers are going to be entering the long-term care system very shortly, okay, within the next decade, or actually sooner than the next decade, okay? And this means, okay, they're all leaving the workforce. So it presents the question, will we be having a lot of financial difficulty taking care of them? Because they're leaving the workforce. They were paying into the Social Security system, which is, that's our, public retirement income, plus Medicare is like an extension of Social Security, okay? So that kind of means, I guess, less money for health insurance and less money for that retirement. It's kind of scary. And this is also going to mean that we're going to need more healthcare professionals to meet the growing medical needs of that generation. Because, as they get older, they're going to require more medical attention. They're going to require long-term care services and things like that, right? Okay, the second reason why this generation is like the focus right now is because many of these baby boomers are like a good chunk of them, okay, were and still are medical professionals. Okay, so in the next coming decade, many of these medical professionals are leaving the healthcare system. They're leaving the workforce. They're not going to be nurses and physicians anymore. Okay, they're not going to be working as nurses and physicians and administrators and everybody. They're not going to be working like that anymore. So they're leaving that, and they're leaving all like a huge vacancy in our healthcare system. Okay. So basically, here's the big picture. We have an increasing number of patients, a whole bunch more patients coming in, right? And we have a decrease in the number of professionals that we are going to have that can take care of everyone and, manage everything. Okay? Let that sink in. Okay. Then we have roughly, it's a rough estimate number, 75 million Americans that make up that baby booming generation. Could be more, could be less, it's ish. And about like 300,000 of them go into retirement every single year, okay? So 300,000 of them leave the workforce, quit paying those, the paycheck tax, why can't I think of the word? The payroll tax, or, you know. So they're leaving the workforce, they're not paying into the Social Security system anymore. Instead, they're taking from it, right? In 2019 is the year that like the last batch of baby boomers are gonna leave the workforce. They're gonna go into retirement. They may or may not leave the workforce. I mean, many people like to actually continue working, but the idea is that people retire when they're 65. So if that's true, then they will be leaving the workforce. So around 5 million people in this country will be expected to be 75 and older. I mean 65 and older, sorry. And then more likely, as time goes on, they're gonna be increasingly needing more and more medical care. So they're gonna be relying on the medical care system in this country, okay? Now, in the past, the Social Security system worked really well, okay? Because the thing is, the ratio of how the money would flow was like, we had 7 working Americans paying into the system, okay? And that money, that those 7 working Americans were taking care of 1 retiree, okay? And it was great. It worked out really well. It was comfortable, okay? It was good. But today, that number has dropped significantly. Today, it's about 4 or 5-ish working Americans paying into the system and supporting 1 retiree, okay? It's dropped by like almost like a third, okay? A third less of the money, okay? And the thing is, it's gonna keep getting worse because more people are gonna be leaving the workforce and depending on that money. So do you kind of see where I'm going with this? Okay, so the thing is, as more baby boomers go into retirement in the next decade, that ratio is gonna get really, really bad. It's gonna get so ugly. And we need to have new ways. We're gonna have way, way less Americans paying into that Social Security system to support each of those retired Americans, okay? So in healthcare, we really kind of need to understand how this is going to affect us financially, and we need to figure out what we can do in order to keep the hospital doors open, to keep all of our medical facilities open, so we can keep accepting patients and we can keep caring for patients, okay? And so that we can keep long-term care services going, and we can make sure that there's plenty available to take care of the baby booming generation, because they're gonna need it, okay? I mean, they paid into the system, so they deserve to have that. And I know we're paying into the system. Of course, we should have it when we get older, but then again, who knows what's gonna happen. We have to kind of figure out a whole different way to handle this. And so since all this is going on, we do need those bright minds in healthcare administration to sort of figure out what these facilities are gonna do, okay? That's my spiel.